If you have a bump on your arm, hand, leg, people usually panic and right away the first thing, oh my God, is it a tumor? Well, most likely it's not. But even if it is, we don't know if it's malignant. So let's talk a little bit about the symptoms, types of bone tumors that might occur, how to diagnose and how to treat these tumors. There are primary and secondary bone tumors. Primary bone tumors are the bone tumors that actually developed from the bone tissue. They have specific age and location when and where they appear. Secondary bone tumors are bone tumors that developed from a different type of tissue, and then they arrived to bone tissue as metastases of that initial tumor. Histologically, these tumors can be bone tumors, cartilage tumors, and connective tissue tumors, because we find these cells in the bones, and from these cells, tumors can develop. The bone tumors would be osteoma, osteoblastoma, and of course, the malignant osteosarcoma. The cartilage tumors would be the chondroma, chondroblastoma, and of course, the malignant chondrosarcoma. There is also one more benign one, and that is the osteochondroma. The connective tissue ones would be the osteofibroma and also semi-malignant desmoplastic osteofibroma. You probably noticed that the malignant ones end with a suffix sarcoma. But how do we know if it's a tumor at all, yet alone malignant one? We should first start with symptoms and clinical examination. There are these so-called red flags that we should never, or should I say, we must never ignore them. First red flag, pain. But what kind of pain? Well, persistent pain. Pain that won't go away, and pain that emerged after a ridiculously light injury. For example, you hit your arm against the door or something just slightly, and then the pain is there and it won't go away, and you take the regular painkillers and it's not helping. Second red flag, swelling. But what kind of red swelling? Hard swelling that is showing the signs of progression. The third red flag would be a fracture. But what kind of fracture? Well, it would be a fracture that happened after a ridiculously light injury. A type of injury that we would never assume could result in a fracture. But we must be really careful here. We don't want to scare the patient. Osteoporosis can also result in fractures. And fractures in osteoporotic patients also happen quite easily. So let's say we identified some of these red flags. We have some assumptions. It might be this, it might be that. What is the next step? Well, the next step would be the radiological imaging. That would include the MRI, CT, or PET-CT. And let's say we actually see something that looks suspicious in these scans. What would be the next step? Well, the next step would be the biopsy. We take a piece of this tissue and we examine it histologically. Only after that, we can actually diagnose a patient with a tumor and we can say what kind of tumor it is. Different tumors are treated differently. And because of this, we cannot cover therapy in this video. We will do it in our upcoming videos. If you need more help and information about symptoms, then go to Symptomsky.com. There you can find experts and our software for symptoms. If you are studying or teaching medicine, Then go to anatomsky.com. There you can find these animations and 3D models in software I made.